Tēnā koutou katoa, Talofa lava, malo alele, Bula Banaka, and warm Pacific greetings to you all out there in the motu. Today we're taking you through a quick introduction to the new COVID protection framework, otherwise known as the traffic light protocols for construction. My name's Chris Polaczuk. I'm from CHASNZ, and we will be hosting this session today for you all. It's been 18 months since the first construction-specific protocols came out, and it seems like a lifetime to me that we've been living with COVID in New Zealand. We began with an elimination strategy, and that worked for a while, and along came Delta and changed everything. We now are moving towards living with COVID-19 in New Zealand, but our mission remains the same. We need to protect our workers, and we need to protect our health system from overburden. The government's moving to the new traffic light system on the 3rd of December, and we'll find out shortly what colour of traffic light you'll be living and working on. This has meant that we'd had to look at our existing alert protocols and had to change them. So there's been a group of people, thank you everybody for your work, from a diverse number of organisations around the place working on this for the last couple of months. And we've got 2 of them here with us today to run through these new documents. Firstly, we've got Adam Still from Site Safe. There's Adam, the man with the beard, who is Site Safe's Business Development, Marketing and Communications Manager. Adam's been a key person from the beginning in designing these resources, and he will take us through the structure and how they are intended to be used. Then we'll hear from our CEO from CHASNZ, Chris Alderson. Chris has been working with the development team and the construction sector accord to make sure that these protocols harmonise with the government's approach. Chris will focus specifically on the risk assessment part of the protocols, so it'll be good. So if we could get the protocols up on screen, and Adam, if you can take it from there, then that would be great.
Yeah, hi everybody. Thanks for the introduction there, Chris. Firstly, I'm just going to be taking us through the protocols and the documentation layout, talk a little bit about how it's designed, how it's meant to be used, and a couple of the options available for you. Before I get into that, I just want to also recognise there were a lot of people working in the back end of these protocols. I just want to thank people for their time and effort. We've gone through, too many variations and changes and reviews to count. And this has been ongoing since the start of COVID. So there's a lot of learnings that we had from the first round going into the alert levels in early 2020, which has been applied into this new version for the traffic light systems. We've also come together as a wider industry and included all construction under these protocols, which is a really good outcome, not just for the sector, but also for everybody within it, and just getting some consistency around how these protocols are applied on site. So I just want to recognise that, and there has been a lot of people and a lot of moving parts to get into here. As you'll see when you open up the protocol document, this is the shortened version, which is the protocols without the resources attached inside. There are 2 versions which are available. One is the protocols with links to all of the resources and documents which are there as guidance on how to apply these on site. Then there is a wider, larger full version which has all of those resources at individual pages within the document as well. So what we wanted to do when creating the protocols is to make it as simple as possible to understand, really easy to apply, and have all the information in one space. So what we have here is the first page. It kind of gives a bit of an overview. One of the key things in here is in the top right-hand corner of the protocols, it has the version number. So this is the first version of the construction COVID-19, the New Zealand COVID-19 construction protocols under the traffic light system. This will be live from the 3rd of December 2021. Do keep an eye out on the version numbers, and do regularly check to make sure that your version is the most up to date. As we found with the alert level protocols, there's a lot of updates from the government that are ongoing, as we operate inside of these. There's also a lot of learnings from within the industry about how these protocols are applied on site, and potentially better or clearer ways to communicate the protocols. So we do often get together as the working group and update the content in here. There will be a version control up in the top right, and there will also be some updates to what has been updated inside of those versions as well on this front page. So do take note of that front page for that reason. As we go through the document, the first page, and this is an important page for us, and we kind of went back and forth. One of the key things that is different between these protocols and the protocols that we've seen under the alert level is around businesses being able to operate under all levels. One of the key things to consider around operating under RED is the risk assessment tool to assess whether vaccination should be mandatory for roles or on site. We wanted this up front. There is a link to this risk assessment in this page. If you click through to the risk assessment, this is an example risk assessment, which will be opened and downloaded as an attachment. So you will need internet access on the shortened version to open that up, and Chris will take us through the risk assessment process a bit later on. But it is a really important part of these protocols, as it identifies what controls a business will need to implement under the traffic light systems to operate. As you see on this front page, we have down the bottom the three different zones: red, orange and green. Then on the right hand side, there's also additional controls. If you follow the arrows across based on the outcome of a risk assessment, where there has been a risk assessment carried out and the site does not require mandatory vaccination on site, then additional controls should be implemented. So we'll get to that a little bit later, and that's where there's the difference between zones, between operating in different zones, with what additional controls are required under a vaccination. If we go through, and this is an interactive PDF, it is designed to be used as a PDF through a computer. It's got clickable links, although we did consider as well that a lot of people will be printing this out. So all of the information is available through the full document without having to click through. Operating under RED. As you'll see under here, this is the RED protocols for operating a site where vaccination is mandatory. But a lot of these will be familiar. It's nothing different to what we have seen on site during the alert level protocols. It's just a different makeup under the different zones. There are a lot of restrictions which have been taken and removed out of here, which will no longer apply unless there is additional controls required under a non-vaccinated site. How to read these is to go through, find out what zone you're operating in under your site, go to the zone of which is related to your site, and then this will give you an outline of the processes that are required for that site. As we move down into orange, you see here that the protocols are reduced to be reflective of the lesser restrictions on site due to the lower alert level. And then as you go to green, again, reduced requirements. One thing that is consistent throughout these 3 pages is up on the top right-hand side, there is a supporting resources link, which will take you through to a page a little bit lower and give you access to supporting resources. The other thing that is consistent is this red text, which talks about the risk assessment that we just discussed earlier and about what additional controls are required where a risk assessment has been undertaken and a site does not require vaccination. So these additional controls are laid out inside of this additional controls page. These are suggested additional controls, which will depend on the level and depend on the outcome of the risk assessment that is conducted by the business. These controls could be implemented in order to manage a non-vaccinated site above and beyond the controls that are already listed inside of the alert level controls. So these aren't in replacement, these are on top of the controls listed in the red, orange and green alert levels. Again, it's not a requirement checklist of things that have to be in place. These are suggested additional controls that a site can implement based on the outcome of their risk assessment. From there, the next page is also the supporting resources. So here what we've tried to do is make it really easy for people to access the information that they want and that they need without getting too much other information in the way. So here we have supporting resources listed out for supporting resources to help implement the protocols on site. So for employers or for managers on site that are looking at assistance for how do we actually take these protocols and implement them onto site. And then we also have a little list on the side there, which are guides for workers. So what is relevant to me as a worker? What do I need to know around operating within the COVID framework? These, as you will see, for posters and signage, will take you through to an additional page, which gives you a list of posters and signage available. Let's say this is a vaccinated site and you want a poster. What we've done is created a link, which will again take you through to a download online. If you're using Google Chrome, it shows up down the bottom, which then takes us through to the poster, which you can have access to print off and use on site, or pass along to your printer who will organise a sign for you. This is a little bit different to the original protocols, as the original protocols all had them inside of a document, which means that people had to manipulate the PDF in order to get just the information that they wanted. The difference between the new protocols is that all of these are clickable through to individual PDFs, which are downloadable for use and printing on site. You also see that this document that I've got open, it's 8 pages. Those are the 8 pages of the protocols: the site signage, supporting resources, additional controls, the 3 alert levels, the main page, and the page that talks through the risk assessment process and what that requires. We also have available, which some of you may have downloaded and already seen, the full version. So this is 38 pages, involves a list of those first 8 pages, but then also follows on to have all of the additional resources which are linked through, all in one space. Some of this will look familiar, as it is edited versions of the previous protocols that we had in place. But again, some of these will be new. We have mates from Mates in Construction have provided us with some additional material which has been created for these protocols and been added in here as well. This is, again, linked through on the site and available to click through for individual documents by following the Mates in Construction manager guides or Mates in Construction mental health guides. As well as in here, we have any help services links to websites, phone numbers, and also information directly from government. So government travel guide and boundary restrictions. What we had last time was trying to include all of the outcomes from the government inside of the protocols. What we've done is, where possible in these protocols, is linked directly to the most up-to-date source of information. This will save us on updating and changing the protocols and requiring new versions, as it will link directly to the most relevant information at the time. I suppose from a usability and function of the site, this is it's a really quick overview, I know. Do take your time to read through what on each level is required. Chris, suppose it's a good time now to talk through the risk assessment process that was spoken about earlier, and what that looks like and how businesses can follow that process.
Yep, great. Hey, listen, I just thought I'd start off with, there's a few questions coming through. For anyone who doesn't know where to get the information from at the moment, it is on the CHASNZ webpage there under COVID-19. I wouldn't mind just talking quickly about just reminding everybody where these protocols sit. And, we often get questions about, are they mandatory? Look, at the end of the day, they're guidance. And we do sort of rely back on the Health and Safety at Work Act for our overall direction here, which is to eliminate and minimise risk to health and safety so far as reasonably practicable. So, we do rely on things like the hierarchy of controls. We do think that engineering controls come first, obviously, with hierarchy of controls, and we do believe that vaccination is, by definition, a engineering control, and that it creates a barrier between the human and the harm. How it works in terms of testing reasonable practicability is, first of all, we go to the Act. There's nothing specific about COVID in there. If there's an approved code of practice, that's useful, but there isn't in this case. We then look at industry guidance, and where these protocols sit is definitely within the industry guidance framework. So what we do have is we do have a standard that's sitting within the website at the moment, and that's a principles-based document because with the best will in the world, we can't actually anticipate every situation that these protocols will be used in. So we want people to go back to the principles if they can't find exactly what they need. And then the construction protocols are basically describing how the principles and requirements may be achieved. We still expect people and sites and businesses to be doing a bit of thinking themselves around this. It's definitely not a paint by numbers exercise. This is basically set out to provide the best guidance that we can think of at the moment to actually help businesses navigate through this. So what I'll do now is I will go through something that's quite fundamental to the protocol. So Adam mentioned that, obviously there's a presumption that sites or roles or businesses are either vaccinated or unvaccinated. And the basic principle is the reasonable practicability that if you can't rely on a strong engineering control like vaccination, then you've got to beef it up with some other controls. So that's the overall fundamental principle. So look, what we did was we developed and tested through quite a few businesses at the moment a simple approach to assessing risk specifically within the construction industry. You don't have to use this if you've got a more nuanced we do know that the government's coming out with some risk assessment advice probably by December the 15th as well. So I'd suggest you have a look at that when it comes out. What the government have told us, though, clearly is that it's really the business's decision about what risk assessment they should use. And we believe that if you went through a risk assessment using this tool, you'd probably most certainly get through to the right result at the end of the day. But you do need to think outside the square a little bit and think of things that we haven't thought of. So look, at the very top of the page here is a couple of blue box and a red box. And this is really fundamental because when we think about harm in the workplace, we're thinking about the additional risk that doing the work brings us. So we need to have a risk appetite to say, hey, look, what is it about the work that we're doing which actually increases our risk from contracting and getting ill from COVID versus being a civilian or doing stuff outside of the work environment. So that's why those two boxes are really important as a little bit of a test. And then what we have is basically two sets of factors. We have role-based factors, so factors about the role, and factors about the work context, which I'll move to in a minute. Now, one of the things we often get asked is, do I do this based on a role? Do I do this based on a site? Do I do this based on a business? And those three questions, we believe you should start off thinking about the role, and that's consistent with the work that WorkSafe does as well. And then the other two questions will become answered as a result of that. So look, there's 6 questions here, and I won't go through them in detail, but look, they're all designed to think about, what is it around construction type work generally that would create additional risk of either getting COVID or becoming seriously sick. So one of the ones, for example, that's been quite interesting is the role exposed to other workplace health risks, such as infectious disease. What we've found from research overseas, particularly within construction, is if you've got other things going on, for example, if you're plumbing and you've got hepatitis or other diseases, then if you do catch COVID, it's a comorbidity and there's actually an increased risk of actually getting really sick. So that's why it's an increased risk factor. What we basically do is say, hey, look, if you've got at least 2 of these, then that's significant. So one of them might not be significant, but 2 of them is significant, so that would actually need to test. If you're saying no to at least 5 of them, then we want you to do one more step, which is think about the role in the context of the work that's being done. So, for example, if you've got a whole lot of workers that by looking at the role, you don't come up with specifically high enough risk, then you find that they're all intermingling on the work site and it's not reasonably practicable to separate them, then that's something you need to consider. There might be high risk individuals within your work teams as well. There might be members of the public that you're coming into contact with as part of the work. And there might be things you need to do in terms of crossing boundaries, or you might actually travel together in the same van every day as you do in a lot of civil situations. So you need to take those things into account as well, because those things do increase your risk profile. They're not specifically about the role, they're more about the work context. So that's the first thing we suggest you do. This part B is around whether a business or business unit should be fully vaccinated. And we do know that there's a number of sort of precedents that you might have got to. You might be subject to a public health order. And if you are subject to a public health order and that you're working in education or in the health sector, if you can't actually, it's not reasonably practicable to segregate that workforce out, then there's a good case to be said, look, maybe the whole business should be vaccinated from that perspective, because I can't actually segregate those people out and make sure that they're not just the ones being vaccinated. Same principles through public infrastructure, for example. We know we've got a case with Watercare at the moment where if most of Watercare went down, we'd have some serious issues with public services, for example. You might also have some roles from Part A that are a significant part of your business that you can't actually segregate from the rest of your business. So one thing we have seen is a lot of client organisations already going down the vaccination path. Now, the only thing we'd say there is, look, if they've done so, using a reasonable risk approach, and there's been a bit of consultation there, and then you still can't segregate those people out, then maybe you are looking at a vaccinated business. Same principles around a site. So think about a site from the same perspective. You could be covered by a public health order. You might have roles on site that do require vaccination, and you can't actually separate those people out from the ones that don't. You might, again, be subject to a client's vaccination requirement. So that's the basic principles of going through a risk assessment. We made it part of a flow chart so it's as easy as possible, but inevitably there will be some questions and some things that we haven't thought of, but which you need to introduce. This little asterisk up here, in case of a medical exemption, what happens to medically exempt people? Look, if you have got some of those, which are very rare, and they need to be obviously medically exempt from Ministry of Health, you probably need to do a separate risk assessment to understand why those people are medically exempted from getting a vaccination, to see if there's other risks involved with them being in the work site. So that's obviously a very special situation. I just wanted to go through another part of the document, which is quite important, because one of the other things we've seen, and a very strong requirement from businesses, hey, it's not if, but it's when COVID gets to my site, what do I do? So that we know that, living with COVID and over the course of the coming weeks and months and years, potentially, that, we're going to have to deal with this situation. We know this is also a very rapidly evolving area, and even as recently as Friday, I heard from the Ministry of Health that they're thinking of changing some of their classifications around what a casual plus secondary is looking like. So we're keeping a close eye on that, and we're trying to keep our information as up to date as possible. So there is some information on here from a personal point of view, just to try and make it a little bit easier, as opposed to the people that say, hey, look, what happens, if I do get a an orange or a yellow, or am I a secondary, and those definitions have changed recently, and these are up to date with the Ministry of Health guidelines at the moment, but at any stage the Ministry of Health could change those. So that's one area why that version is very important that Adam mentioned. We also have had a question around what happens to my site if you've got a COVID incursion. And what we've found is that the public health, Ministry of Health contact tracing environment is not really keeping up to speed with the pace of things happening in Auckland in particular at the moment. So we've seen sites where people have been notified as casuals or as close contacts up to 5 days later, which is too late. And we've also seen a really inconsistent approach from Ministry of Health. So what we're suggesting is that construction sites who want to can take a little bit of a step forward into that space. And if you do have an incursion, obviously, talk to the Ministry of Health. But what you can do is use some of the information and some of the guidance here to actually manage through that situation. What we're trying to do is get to a point where if you've got somebody who's tested positive on site, you can easily, and hopefully easily, identify who are the close contacts, deal appropriately with those close contacts very fast, so get them out of your workforce. If they're vaccinated, it's 7 days at home. If they're unvaccinated, it's 10. And what you then do is get to the point where you're deciding, whether my site can continue or not. So it's not an automatic close the site. It's, hey, who have I got left, and can I safely operate with my remaining workforce? Do I actually need to monitor that remaining workforce? Yes. Obviously, you need to make sure that people aren't getting ill and they aren't becoming symptomatic. The rapidly evolving issue of the RAT testings or rapid antigen testings, that's shaping out over the next couple of weeks as well. And as we know more about that, we'll be able to sort of say, hey, look, surveillance testing through rapid antigen testing could be useful in this situation. So, for example, we can imagine that if you have got some people who are COVID positive on site, you've identified the casuals, you're now thinking about how much further it's got, and maybe rapid antigen testing could be part of that solution. We're not seeing rapid antigen testing as a widespread daily surveillance method at the moment, mainly because of the cost. Look, it is still around about $10 a test. If you multiply that across your workforce for every day, it starts to become quite unpractical to do so. So look, that's a key part of it, and obviously this is an evolving. A lot of these other documents we've seen in here that Adam's talked about are very familiar, but I would also just direct your attention to the mental health resources in there, because what we have found, and it is of concern, is that when people are isolating in particular, some of them actually have some needs that aren't being met potentially. They might be isolating at home, they might have language difficulties, they might have other things going on, and it is important that as employers and as people that care for our workers, that we're actually taking a step into and making sure that they're okay. And if we do that, what we'll find is people will become a lot more confident in actually informing the workplace, when they are COVID positive, as opposed to potentially not telling the workplace, which is not what we want. So we don't want those people to be supported. We do want stigma removed. We've seen situations where people have turned up and brought COVID onto their sites, but no fault of their own. They were asymptomatic, and there's been a bit of a kickback from the workforce as well. So those are the things we need to watch. We need to actually help people.
Kia ora, Adam and Chris, tēnā pai boys, well done, and thanks to everybody that was involved in this massive bit of work. It's awesome. Cool, so we've got plenty of questions running in. Actually, I'll kick off with the question, because maybe for you, Adam, what happens to the old protocols now? Do we just bin them and wait for the new ones on Friday?
Good question. So, obviously we're currently still working under the existing protocols. So they're still in place until 11:59 p.m. on Thursday, the 2nd. So They are on the websites, both CHASNZ and Site Safe, and we should still be abiding by those protocols until we move to the traffic light. Once we move into the traffic light system, we'll still have those on record, and mainly just because the government has indicated to us that there may be a level 3 or level 4 style lockdown, again, either regionally or nationally, if the health system is overwhelmed. So we haven't got much guidance around what that may look like, apart from that it will look like level 3 or 4. So what we will do is just keep those handy and continue to update the industry on what that would look like as we get more information from government.
Question from Steve. Are we anticipating that we'll have to collect these vaccine passports on site? Have a register? How are we going to do that?
Yeah, so look, this is an ever-emerging area at the moment. We do know that obviously that the vaccine passport reader is now freely available on Apple and Android for sites that will go down the path of checking individuals. So that's probably the most simplest way of doing it. If a person hasn't got a vaccine passport on their phone, then obviously the physical document should be looked at as well. What we're sort of starting to see, and we are doing some work on at the moment, is the requirement for maybe businesses who are required to have a vaccinated workforce to actually self-certify that their business is will actually send you vaccinated, or all those who can be vaccinated will be vaccinated workers. We're currently just working through the process for that at the moment, but and realistically, it's going to be clunky to start off with. As we get used to this stuff, and this is where we're quite interested in hearing from industry about better ways of doing it as well.
But has there been any talk about the new strain and how that might affect us, the Omicron strain?
So, plenty of talk. The only thing we can sort of fall back on at the moment is, look, we use the best tools we have in the toolkit at any one time. That's what we're ethically obliged to do. And that's our approach, is these new tools hopefully emerge, and that the science tries to keep up with new strains. Then we'll adapt and adopt after that. You could have asked us the same question 6 months ago around Delta. It's obviously something that has emerged between Friday and Monday this week.
Yeah, I think one of the key things is around these protocols, same as last year and with Delta this year, and as things evolve, and it's outside of our knowledge or control at the moment of what that may or will look like in 6 weeks, 6 months, 6 years time. So what we are doing is catching up as a working group to make sure that as things develop from government and as we get more information around the new strain or or any changes that government release, that these protocols are reflective of those updates and those changes for the industry.
There's been a move away from minimum working distances in the guide. Any rationale around that?
Yeah, so this is one of the issues that's really been quite difficult for construction businesses to manage, because we know it's a physical job. People are often, shoulder to shoulder to do jobs safely, for example, lifting windows into a residential building. And it has been something that we felt that, look, if you have got a fully vaccinated workforce, and this is one of the controls that we can probably lower a little bit. The other thing is we know that, particularly with Delta, that the physical distancing perhaps isn't quite so relevant anymore, because it's not just 1 metre or 2 metres. If you're 8 metres away from someone indoors, then that's probably not even quite enough physical distancing. So therefore, that was one of the rationales between lowering the requirement around physical distancing. We're trying to balance up, obviously, the risk of COVID with the risk of someone hurting themselves at work as well, which we don't want. So, it is a balance.
And here from Mark, are the additional controls for unvaccinated people only on a non-mandated site? Adam?
Yeah, so the way that the additional controls work is that if the site is requiring vaccination as mandatory, then or as a vaccinated site, then the additional controls do not need to be put in place. So the risk assessment and is provided is based on risk assessment for vaccination. Obviously, your own risk assessments and work specific, activity specific risk assessments will need to continue to happen. But this is just around whether vaccination is required for the role and whether it's required for the business or the site. If it's determined that vaccination is required, then those additional controls do not need to come into play, and you just need to look at the red, orange and green.
Question from Christian. Any thoughts on converting some of this documentation to other languages?
Yeah, we're just looking at that at the moment. I think it's a really good call. Obviously, the languages like Mandarin, Tagalog, Samoan, we're pretty first up.
How do we manage if an employee has 2 vaccinations but doesn't want to get a booster?
So I think this comes down to how you define what fully vaccinated means. So in our minds, fully vaccinated means that you are keeping up with whatever the health recommendations are around vaccination. So, someone who's had 1 shot isn't fully vaccinated, and if we find that somebody's overdue for a booster, i.e. their existing double shot has fallen below a level of efficacy, then we would also say they've probably slipped out of being fully vaccinated.
And
we'll have to follow Ministry of Health advice on that. We don't have that right at the moment.
Yeah.
And is there any news on mandating vaccinations in the construction industry? Where are things at around that?
Yeah, it's not going to happen. So there was a lot of organisations, registered master builders, a number of others that were asking for a vaccine mandate. It's a political probably decision at the moment from government, in that they haven't gone down the path of vaccinating construction, and our money is at the moment that they won't.
If you have a vaccinated site, does that mean any delivery drivers that are moving between the different sites but have limited contact need to also demonstrate that they are vaccinated?
What do you think, Adam?
As the protocols are, yep. If somebody's accessing the site, then the requirements for if it's mandatory vaccinated site and somebody is accessing their site for delivery purposes, then they require to be vaccinated. If they are not, then that role will need to apply additional measures. And based on the risk assessment, the site is therefore not fully vaccinated, then additional measures will need to be put in place around those activities on site. So physical distancing may be in place, maybe face masks, etc. that is required, or if they can turn around a positive test, and that needs to be an outcome from the risk assessment based on the activity or the types of activities that will be happening on site.
It's probably just worthwhile mentioning as well that obviously, as in last time, there's a lot of questions that come through on a daily basis, and that both CHASNZ, Site Safe, Master Builders, CCNZ, all the different associations are kind of geared up to help people answer these questions. So there'll be somebody there, and I think there's a list of numbers and emails on our website where people can go for more guidance. So it's probably important.
But thanks, Chris and Adam, for your efforts today, and thank you all, you people out there who have attended this webinar. I know that the pandemic's going to continue to be a developing thing and an unfolding thing, but I can reassure you that we're all behind you guys, and we remain committed to helping you manage our way through this. And together, I think we can all do it. So, kei ako rangitanga, and tēnā koutou katoa. Ka kite, we'll see you later, guys. See you again.